Hello and welcome to Health Professional Radio. I'm your host, Neil Howard, and we're going to talk about the role of social media briefly, and we'll also discuss some mobile apps that provide support and how clinical trial matching works. Welcome to the program, Dr. Daniel Vorobiev.
Thank you, and thank you for the invitation, Neil.
Well, give our listeners a bit of background. I did say that you're an expert in oncology, medical research, and you're going to answer some questions. So tell us a bit about yourself, your specialty. Where did you receive your medical training?
Yeah, okay. Well, it's a long story. I try to make it short. I was born in Argentina, and I studied there. And then I moved to South Africa, and where I did my training under my mentor, Professor Farquharson, who actually recently passed away, very, very well-known oncologist worldwide. Mm-hmm. And that's where I have spent most of my time. I have worked in South Africa for these years, and we have been to national cooperative groups in the United States and in Europe. Mm-hmm. And I have been also involved in academics and in the management of the Society of Oncology, being president of it twice in South Africa. And I'm also working with the American Society of Clinical Oncology and the European Society of Medical Oncology. So I have been around, as they say. I am very, very much involved into education. Lately, the past 2 years, I'm less involved with the clinical side of oncology, but more with education, organizing meetings, international meetings. And the past year and a half, I have joined as a medical director this specific social media called belong.life, which I think it's the purpose of this talk, to discuss more about it and not much about me.
Well, tell us about your work with belong.life. How does belong.life help caregivers of cancer patients and patients alike?
Yeah, well, it helps caregivers to help the cancer patients, and it helps cancer patients directly too. Approximately, we have at the moment 140,000 patients registered with the application. It's a mobile app, and worldwide. The majority of the patients are in North America, but they are also in Europe, in South Africa, in Israel, in India, and other places. So what does it do? It's, first of all, it's an anonymous application, it's free, and it gives personalized treatment. I call it a GPS with a soul, because we give that extra to our patients. We provide with a variety of tools to better cope once they are diagnosed and thereafter too. It provides help to the patients and to the caregivers in how to help their other family members and the friends, etc. The patients have, it is different from any other application, because the patient has different, I would say, rooms to visit. It can talk to other patients in similar situations. He can obtain specialized opinions from the doctors involved, and as well as other services such as dietitians, clinical trials, and all, once again, is anonymously done, and it's free, and it's personalized for that specific situation. So patient can also receive education, the caregiver can receive education, how to manage certain side effects, certain problems, what is new in the world of oncology. They can participate in surveys, and if interested, also they can make use of a clinical trial matching, which we can do once again, at no cost, and this looks like a commercial, but that's very important to know because there are certain applications available that cost a lot of money to actually be referred to or be clinically matched for that clinical trial. So all that is what this application offers our patients. So yes, it's a social network for patients, and it is the largest in the world at this present time and continues growing.
You know, you mentioned that the app can give the user information and keep them up to date as to what's going on in the world of cancer diagnosis and treatment.
Yes.
What would you say, in your opinion, is I guess, the most exciting new cancer-related development? What do you think is the most promising thing on the horizon?
Well, I think that the most promising thing in the horizon is that you will see in a few years from now, I'm not too sure I will see it, but I'm getting into touching my 70s now, but I suppose until in the next 5 to 10 years, we will see something which is starting to happening in research at the moment, is that matching patients' treatments, they are mutations. We have mutations in our bodies which are causing cancer. That cancer mutations are being identified more and more and more, and we have tools for that identification, that profiling of those mutations. And what we are going into now is treating those mutations and not actually treating the patient's disease per se. So if you are diagnosed with breast cancer today, we treat you as a breast cancer patient or colorectal cancer or whatever. In the future, we will be treating the mutations that are causing your breast cancer. So instead of having in a big hospital, cancer hospital, having a breast cancer department, we may have a mutation cancer department where patients will be receiving specific treatments developed for that mutation that they carry.
When you say that we'd be treating the mutations, would those mutations throughout the entire body so that any other cancers that might be looming would be abated before they ever manifest?
Yeah. The treatment is mainly a systemic treatment, and it will remain a systemic treatment because that's the nature of the cancer. It's a systemic disease. Very seldom the cancer is localized to one area. For that, we will continue using conventional surgery or radiotherapy. But when the cancer spreads out or has the ability to spread out, then that's where the systemic treatment will be implemented. And that systemic treatment will still use some of the current treatments, such as chemotherapy or targeted therapies that we have, or hormonal therapies, or immunotherapy, but they will be targeted to the specific mutation that that patient carries. At the moment, we do not have enough drugs to attack or target those mutations. We have, unfortunately, at this moment, more mutations than drugs, but hopefully in the future we will have an equal situation, which we will be able to help our patients in a better way.
Well, where can our listeners go online and get some more information about Belong.life and learn a little bit more about Dr. Daniel Vorobioff?
Well, I think that application, they will be able to, the application, as you mentioned, Belong.life, they will get all this information. They will get more about myself. They can join any of my groups there. I'm manning the Ask the Oncologist group. I'm manning a group in India. I'm manning a group in of breast cancer patients. So they will see, and there are many other doctors that work with us. This is not just an effort of a few people. We have something like 70 doctors manning many different other aspects of cancer, from any cancer to side effects and any other thing that is related to cancer. So they will see the list of groups, and they can join them with the greatest of pleasure.
I appreciate you joining us this morning and bringing us this information. Thank you so much for joining us on Health Professional Radio today, Doctor.
Thank you very much, Neil. Thank you again for the invitation.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Transcripts and audio of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to this podcast on iTunes, listen in and download at SoundCloud, and be very sure and visit our affiliates page when you visit us at hpr.fm and healthprofessionalradio.com.au.
Thank you for listening to Health Professional Radio. We're very proud to be an independent broadcaster providing our content free of charge to you, the listener. One of the ways that we're able to remain free and independent is by having people like you become patrons. You can support Health Professional Radio simply by visiting hpr.fm and clicking the button that says Become a Patron. Your patronage of even just $1 a month lets us know that you're there, which in turn makes us more valuable to advertisers. And, of course, if you're able to afford more, then we would certainly appreciate the support. My name is Toby Longhurst from Health Professional Radio. Please visit hpr.fm, click the Become a Patron button, and support us if you can.